We're 8 months into the COVID-19 pandemic now, and yet a surprising number of people continue to avoid seeking medical care they need for fear they'll acquire COVID-19. If you're one of these people, you're taking an unnecessary risk with your long-term health. If you're concerned about becoming infected from being treated in a hospital or medical office, our experience shows there's very little risk of this happening. In a study out of Boston Hospital that examined 9,000 admissions with 700 patients who had COVID, only two cases of hospital-acquired infections were identified out of those 9,000 patients. The study concluded that with rigorous control measures, hospital-acquired COVID-19 is rare. Rigorous control measures are followed here at Charles Regional and in our medical offices. Frontline doctors, nurses, and technicians have been called heroes for their tireless work taking care of COVID patients in hospitals, and it's well deserved. But there are unsung heroes too. The environmental services staff, our engineers, and our food service employees, all whose diligent cleaning and disinfecting work helps keep us safe and free of infection, doctors and patients alike. Our limited visitation, social distancing, and universal face mask policies may not be popular, but they're essential to protecting our hospital and office patients. On the other hand, there's disturbing evidence about the impact of delaying medical care during the pandemic. A recent study in the Journal of the American Medical Association showed an increase of 20% more deaths than expected for March through July 2020. COVID was a leading factor for about 2/3 of them, but in a third of those deaths not due to COVID, the cause is believed to be acute complications of chronic illnesses for which people put off receiving medical care. Aggressive cancers that were not treated in a timely manner may begin to show up as well over the next 6 months, and in fact, screening programs are seeing fewer participants. Don't let this happen to you. Our hospital and medical offices can safely provide you with important medical care. Personal protective equipment supplies are strong. Testing supplies are good. COVID patients who need to be admitted to hospitals are treated in isolation from others to avoid exposing them to the virus. These measures work. The risk of acquiring COVID from inpatient or outpatient care in a hospital, including Charles Regional, or a medical office is extremely small. As a doctor with 40 years of experience, I urge you, don't put off getting the medical care you need. The pandemic will end. We want you to be with us at the end of that.